Hello, hi. Hi guys. How's everyone doing? Hello. Hello, hi. Hi everyone. Thanks for joining in. We'll be starting in just a minute. Yes, you will definitely be getting some tips. I'm good, thank you. Thanks for asking. Great. So we'll be joined by Dr. Amee. Yes. Hi, Doctor.
Hi, can you see me? Can you hear me?
Yes. I hope everyone can hear us clearly. You can just give us a quick thumbs up if you can hear us. Hello, hi everyone. Great. Can everyone hear us? Awesome. Awesome. Okay, great. So let's start. Thanks everyone for joining us. This is a new series, so to say, that Health and Glow wants to begin. We're calling it Know and Glow. This is session number 1, and I think, what better day to begin than World Health Day. This session, through this series, essentially we'll be talking about skincare and beauty related topics, and hopefully, you'll find value in them. So today we're joined by Dr. Amee. Dr. Amee has more than 20 years of experience in dermatology, and she runs a very successful practice with Think Skin Clinic in Bangalore. Dr. Amee, thank you so much for joining us today. It's a pleasure to have you here, and we get a chance to speak to you.
My pleasure.
Great. So today's session is the topic essentially is where to begin skincare. And I think what we really wanted to talk about with this session is for people who have been doing skincare and for people who haven't started or don't know where to start skincare. I think what we want to cover is what are some of the things that people who are doing skincare might be doing wrong, or people who don't know where to begin. How is it that they can really begin taking care of their skin. So I hope that all of you, want to learn more about skincare and have lots of questions, because, that's essentially what we're here for. Um, Okay, so Dr. Amee, I think we'll start with setting some context. I think skincare is such a topic that I think everyone has a different view on it, really. And I think given that you've been doing this for more than 20 years, you've been in the field, I think the first thing I'd like to know from you is, first of all, why do you think it's important for one to take care of the skin, and why is this something that's so close to your heart as well?
So, Rashmil, just quickly to tell you that, before I joined my MD, all my friends were looking at gynecology and, radiology, surgery. And I was very much looking forward to dermatology. And I was asked why, and I had only one reply, that skin is the largest organ of the body. So there will be maximum challenges. And I think I want to take that challenge. So, which is why I took dermatology, and which is why skincare is so important, because we forget that skin is the largest organ of our body. And it is such a vital organ, because it's a protective shield between the external environment and our essential organs inside. So, it's so important to take care of that. And I think in some way, I thank Health and Glow that you're taking these sessions with us, because, we have a limited patient base, but here we're going there, out there, and telling all your customers how important it is to take care of your skin. So thank you so much. I should say that before we begin.
Thank you
And
so much. And I think, yeah, I think this is something that I think at Health and Glow also, we all feel so passionately about this. And we also know that skincare isn't a one size fits all thing. So it's so important for people to know how and where to begin.
Absolutely. And which is what we're going to discuss and share today. And a couple of things that I have learned with experience, I really would like to share with everyone. The first thing to begin with is skincare isn't anything different from probably drinking water or brushing your teeth. So the minute you see a baby getting these very small buds of teeth popping up, we start hunting for the best toothpaste and the best brush, which is soft and gentle. But the baby is born with skin right from the beginning. So taking care of the skin is as essential as taking care of those small buds of teeth that come out. So skincare is essential from day
Absolutely.
one. And that understanding is very important. Why? Because we have to look at skin health and not beauty. So
Yeah.
skin health is the vital thing when we relate it to skincare. We're not talking about beauty. And once the skin is healthy, it's always beautiful. So that connection we need to understand. Then it just becomes a part of our lifestyle. It's not an extra thing that we have to do every single day and remember to do it. So that's one thing I want everyone to understand, that we just normally have to take care of our skin like we would do for other organs.
Right. And I think for a lot of people here, in my experience, when I talk to people about skincare, I think I get so many different responses. There are people who are so into it and do a lot of research and, check out a lot of different places where they can read more information about skincare. And then there are a lot of people who are, don't know where to start, or, for them, skincare is like, okay, I get up, I wash my face, I moisturize. And that's really how it is. So I think it would be nice if we can also understand, where does one really begin skincare? What is the right approach to really start taking care of your skin?
Yeah, no, that's really important. If you understand, as we grow, as more we get exposure, as our skin starts getting exposed to external environmental as well as internal issues. So when you're a baby, all that you need is a good body wash and a moisturizer. As you start crawling and going out, generally as dermatologists we say from 6 months of age you should use a sunscreen, even for a child. I know there will be a lot of woo and ahs in the crowd
Yes.
here, and 6 months, why should I use a sunscreen? It's a chemical. But the one very important thing is even water is a chemical. It's H2O. Even your toothpaste is a chemical which is actually going to go inside your body. So a
Right.
sunscreen is just an external protection from the ultraviolet light. Now, another question that people will say is that, oh, but my grandmother never used, my mom never used, and they were blessed with healthy skin and great skin. Here again, we need to remember that we have to change with times. So like, we get a GPS now, and, we can online order food, and we are moving. We're not saying, my grandmother went to the shop and picked her vegetables and fruits. No, we're ordering on McBasket or whatever we follow. So we change and we move along with the changes in time. And same thing we need to remember, that with the climate change, with the environmental changes, with the kind of device and other exposures that we have, our grandmother or mothers never had that. So with those changes, we need to change our skincare too. I see so many people on Insta Live with those lovely large glasses, and I think I should invest on one of them. So we're changing with time because we have so much device exposure. We're protecting our eyes, so we need to protect our
Yeah.
skin too. So so that is why it's so important that we start at an early age, because prevention is very important. When we reach the phase of cure, we don't have so many choices. You can't reverse the changes that you have done on your skin, which is the reason prevention is very important. And I don't know, I keep saying this over and over again, that sunscreen is the biggest weapon that we have. Because sunscreens in today's world, we have great moisturizer in it, we have sun protection in it, we also have added things now like even anti-aging, antioxidant, like a vitamin C in it, a hyaluronic acid in it. So sunscreens now have become a vast area where just one cream or one sunscreen can give you multiple benefits. So use of a sunblock, a sunscreen is very essential. That is first. The second thing why skincare is important and you need to start early is because the climate change that we have, we are noticing dryness. We are noticing very abrupt changes in skin, like suddenly acne at the age of 35. I mean, when you've never had acne as a teen, why? So, it's partly to do with the external exposure and partly to do with the stress and hormonal changes within. But if you've been exfoliating regularly and if you've been working on your skin well, those pores don't get blocked. So you don't see those acne, even though there are changes in the environment or within you, which is why a regular skincare routine very early in life is important. So to make it very short, up to the age of 10, a physical sunscreen, a moisturizer, and a very good body wash is important. When you go from 10 to 20, that's the time there are hormonal changes. So you need to have a routine where you put in an exfoliant once a week. Very important. Yeah. And if you have acne, absolutely important are anti-acne creams and anti-mark creams. Now you'll ask me, why treat acne? Because acne is something which will go on its own. We treat acne so that you don't get permanent marks. That is why acne is treated. So that is up to the age of 20. When you go from 20 to 30 is when you need to start looking at anti-aging. Anti-aging is not 40 plus. We're not saying aging, we're saying anti-aging. So, you have to prevent aging. You don't have to treat that age. So that's when you start your anti-aging. You can pick up, there are multiple products, but the active ingredients is what you need to read and check. Especially, this is the age where, women especially, have a lot of hormonal changes to pregnancy, then there's lactation. And during pregnancy, a lot of anti-aging creams cannot be used. So that's when you need to check what you're using. So that's your 20 to 30. 30 to 40 is when you really go strong anti-aging with antioxidants. Yeah, I'm making it very simple. 40 onwards, you just got to continue the same routine and add certain actives if you have any problems like pigmentation or anything else.
Right. I think it's so important, one of the points that you brought up, because this is something that I was reading the other day. I think actually I was watching a video where, someone said that it's so easy for us to say that, my mother or my grandmother or my grandfather didn't use these things. Why do I need to use it? But I think it's also so important to understand that you are not living that lifestyle. You're not living the lifestyle that they did. They did a lot more, manual work and things like that, which kept them fit and kept them in shape. Whereas, we're used to such a different lifestyle. So if you want to do what your grandmother or your mother was doing, then you must also follow through that lifestyle. And like you said, environmental changes, external changes are so drastic these days that one has to be more careful.
Yep. So I
I
make
think,
it simple. Yeah.
yes. I think now that you spoke about, I think sunscreen is just so important. I think that's something that, no matter how much you stress, it's just, one has to and one really should do it. It would be nice if you can share some, inputs on what to check for or what are some of your favorite products when it comes to sunscreen, because I think if people are interested and I think we've piqued their curiosity enough, they might also want to know what they should look for or what they should go for when it comes to sunscreens.
Yeah. Good. So this is a very easy topic for me because I'm very passionate about sunscreen. So thank you so much. So for everyone to understand, a sunscreen when you pick up, it's not SPF, that's just a part of sun protection. So if you look at the sunlight or the spectrum that comes down, you have the ultraviolet spectrum, which is A, B, and C. C doesn't reach our earth. So you have A
Right.
and B, you have sunlight and you have infrared light. Now, what we really need to work on is A and B. UVA and B, because ultraviolet A and B are the major deterrents to a human skin. If you look at A, it penetrates much deeper and it causes more degradation of collagen. So you start noticing changes of A much later. It's not immediate. What you see with B is superficial because B doesn't penetrate the epidermis. It's just right up there. So it causes burning and tanning. So you see immediate results or problems with ultraviolet B, which is why initially we had sunscreens which only took care of tan and burn. That's why we just had
Right.
SPF, that is sun protection factor, against B. Now, later, with a lot of research, we realized that A is actually more important to be protected from because of its aging problem and pigmentation. That is why the PA factor came in, where we started measuring the quantity of UVA protection in a particular sunscreen. And then WHO made it mandatory that you should pick up a sunscreen where it's written broad spectrum. So whichever brand you like or whatever you follow, it should have broad spectrum written on it, where there is an SPF with a value and a PA with a plus sign. So this tells you how much protection you're going to get. Now, another misnomer here is the more the plus signs and more the SPF, like a 50 or a 70, it's going to give me more protection. It isn't like that at all. SPF just tells you that if you suppose go out in the sun without protection and you get burned, say in 10 minutes, if you apply an SPF 15, it'll be 10 times later. So it'll be 150 minutes later. That is why we keep reapplying the sunscreen. So if you apply a 15 or a 30 or a 50 or a 70 also, you have to keep reapplying every 2 to 3 hours because it tends to wear off from the skin. So there is no protection. So one application will never help. That's the one thing. The second thing that you need to remember in your sunscreen, there are two types of qualities of sunscreen, as in what is the ingredient. Now, one ingredient is only physical and one is the chemical. Now, nothing is better than the other. It depends on what kind of lifestyle you have or where are you going. So physical sunscreens are what we recommend for kids up to 12 years of age. We do not use chemical sunscreens for children. That's the first thing. Why? Because physical sunscreens are as if, you've applied a kind of a black mask here. The sunlight comes, hits, and is refracted back. It doesn't enter the skin at all. So for kids, we don't want to apply chemicals. We only put the physical sunscreen. This sunscreen, the advantage is it's immediate acting. So if you just have to step out now, you apply it and you're good to go. The disadvantage here is that it has a little bit of a white color, a white sheen, and people may or may not like it. So that is the issue with physical. You have the chemical sunscreens, which work by the virtue of absorbing the ultraviolet light, converting it to heat in our skin, and then negating the effect. So these chemical sunscreens work that way. So they take time to act, which is why you need to use these sunscreens about 20 minutes before you step out so that they start acting. Many a times before stepping out, we put the sunscreen and then walk out till stop and sorry, it's not going to act.
Not helping.
Not helping at all. So you need to remember that. What I like is a combination of physical and chemical sunscreens because it gives you both protection. So for athletes, for runners, for bikers, you should apply two. First a chemical sunscreen and then a physical sunscreen. It gives you maximal protection. So, you should use this every day, even if you're indoors, even if it is cloudy or, you're not stepping out or whatever it is, you should use a sunscreen irrespective.
Yeah, so I think that was a quick masterclass from you on sunscreens, but I think we will also talk probably more in depth about sunscreens in our next session, which will be more about summer skincare. So I think we'll bring that up at that point as well. I think another thing that I feel we should address and talk about, and like I said earlier, in my conversations with people about skincare, and I've been doing that a lot lately. People generally, what I've realized is when I ask them, how did you come up, like if you have a skincare regime, like how did you come up with that skincare regime? I'm interested to know where you get your information from and how did you come up with it. What I realized is that a lot of people go by recommendations of family and friends, or, they follow a lot of influencers online and they, look at what they're saying, and largely it's very experimental because you try something, you see if it works. If it doesn't work, you try something else. So I think it's also important to address what are some of the common mistakes that you see people make when it comes to skincare, right? Because I think it's important that one realizes when they're making that mistake and, being able to correct that. So in your experience, what have those been, and, how do you think we can rectify them?
Yeah, that's a very good question, Rashmil. Because while we follow the influencers and we follow them, sometimes, we do not understand the science and, the medical aspect of this, because skin is a living
Right.
organism. It's a living tissue. So it's not like fashion that today, bell bottoms are working and you wear that and the next day you wear just tights. It doesn't work like that. It's not fashion. It's very personal. It's very customized. So while, your mother loves using Upton may not work for you, So that's the
Right.
reason. First thing you need to know is to understand your own skin. You need to know what kind of skin you have. Your skin actually talks to you, It tells you that I'm feeling dry, or I'm feeling itchy, or you use this particular product and, I'm not feeling good about it. The minute you look at yourself, just give some time before you actually decide that I need to put like 5 different serums on my face, what your skin is telling you. And to understand the skin, nowadays we have so much, material and so much technology that you don't have to just look at yourself or ask your friend. You can ask an expert. You can go online and you can check what skin type you have. You can go to a dermatologist and talk to them. So there are so many ways and so many things that you can do. Like, now you have the skin expert in Health and Glow. It's really good.
Yeah.
And I encourage everyone to go and do that. And you should do it every weather and every season. The reason I'm saying this is that your skin is going to behave differently every season. In summer, you're going to feel differently. In winter, you'll feel dry. When it comes to monsoons, you'll start noticing a little more combination skin. So there isn't one particular skin that you have, a skin type. So it's important to go back, keep checking with these skin experts to know currently how is my skin behaving. And that is why you'll need to know then which products are going to help me. So understanding your skin is the first thing, rather than just asking people or following people, is what I think. The second thing is stick to your basics. You know that a particular moisturizer is working for you, a particular sunscreen is working for you. You just go with that and try not experiment too much. The third important thing to remember is that, we need to look at hypoallergenic products. So while I
Right.
love fragrance and I love the lavender, it just soothes my skin, myself, my mind, it may not
Yeah.
work for my skin, because essential oils are very, very particular and they change with weather. So in winter, if you put, say, a citric acid, a citrus based fragrance cream, it might dry out your skin. So you need to check every time with the change in season and your skin how that works. So the first is understanding your skin and then going to the routine. So that is what I would recommend to all our patients.
Right. And I think since you spoke about Skin Expert, I'll just let everyone know a little bit about Skin Expert as well. This is personalized skincare, that we're offering to customers. It's an absolutely free tool. You can take it online on the Health and Glow website or app, or you can walk into any stores, and we do have experts there to guide you through the process. But essentially, it'll allow you to know your skin beyond just telling you your skin type. It'll tell you what your skin is like based on 10 factors, and also based on the analysis that you get of your skin, it does recommend a regime that is tailor made to your skin type. So I think it's definitely something that is worth checking out for everyone who's interested in knowing more about it. Dr. Amee, coming back to what we were speaking about earlier, and you spoke about skin type. I think we know at an overall level that there are 4 skin types. And I think something interesting that you brought up is how our skin type also tends to change over time. So I, as a consumer or as a layman, I would want to know how often do you think I should actually check my skin or check to see if my skin type has changed? What would be that duration, and what is the right way to check that?
So see, first thing, as I said, your skin talks to you. So the first thing when you wake up in the morning and you look at yourself in the mirror when you're brushing is when you know how your skin is feeling. You might feel dry and stretchy. You might just feel as is, or you might suddenly see breakouts around your nose or blackheads and whiteheads. That tells you, how your skin is behaving. So suppose, it's like a month of Feb or March when the winter is just subsided and summer has begun, but you're still using a heavy moisturizing cream for your skin at night.
Right.
You're going to get breakouts, because that cream is going to block your pores, because now in summer you don't need that moisturization, right? So you need to move
Right.
from a cream to a gel, so that the gel is not so heavy on your skin, and it'll help you. So every change of season, so every 4 months generally, is when you need to figure out how your skin is behaving. And as I said, just step back and look at your skin. It'll tell you. Of course, you have experts, like you said, our Health and Glow app has that. You can meet a dermatologist and you can discuss the skin, and then probably tweak around your regime. That's all that you need.
Right. I just want to tell everyone at this point that you can use the question widget at the bottom to ask us any questions that you may have regarding skincare. I think we can take a few questions here, and I think we will have a lot more sessions ahead. So if you have any questions with respect to where to begin skincare, or where should you start, or even something that you might be experiencing right now, you can use the question widget and share those with us. Okay, I think one question which is also in my mind, and I think it's something that everyone has, because we don't know if it's a myth or a fact, but I think it's a fact. So how much does drinking water help your skin? And I think that is hydration, when you say that, and obviously drinking water is in general important, but how important is it to your skin?
So yeah, that's a good question, because anytime, you see dry skin, you will have someone telling you, oh, drink water, you're not drinking enough water. So, we need to remember that there's a lot of difference between dehydrated skin and dry skin. They're two different things, A dehydrated skin is, yes, when there is less hydration in the body. Like suppose, you've got a fever. You're suffering from fever, and when the body temperature increases, there's a lot of evaporation of water that happens from our body, and that's when you
Yeah.
notice skin drying and shriveling up. That is dehydrated skin, where you need to drink a lot of water. But a dry skin is not related to water directly. It is more related to moisturization and prevention of evaporation. So what you need in dry skin is a good moisturizer that can prevent water from getting evaporated, as well as hydrate your skin. So these are the two things that you need to remember, that drinking water is not for dry skin, it's only for dehydrated skin. And if someone asks me, how do you know whether it's dry or dehydrated? The first thing is the under eye. If you see the under eye is looking very, very wrinkled with multiple lines, and you can start seeing your veins below that, and it is suddenly
Mhm.
that you're noticing, say after a week or 10 days, and suddenly it has come, dehydration has begun. This is the first telltale sign. Then, of course, you'll start noticing the skin on your arms, your legs, especially the exposed areas, which will look very shriveled and wrinkly. They won't be dry,
Yeah.
they will look wrinkled. That's when you know that there is dehydration and you need to increase your water intake.
Right. So someone's shared a question here. Should one use a cleansing milk or a face cleanser in CTM?
So that again depends on what kind of skin you have. A
Right.
cleansing milk is good for, when you've applied a lot of makeup, or you've applied 2 layers of sunscreen, when you do not want to use very drying face washes, because you have to remove those 2 or 3 layers that are there on your skin. So you would want to
Right.
begin with a cleansing milk and then use a refreshing face wash. So a cleansing milk is only when you're using multiple products, be it makeup, be it skincare products, irrespective. Whereas a face wash, again, is very typical. depending on how your skin is behaving at that time. If you're noticing, a combination, a lot of blackheads, and you apply, if you see a lot of acne coming up, you use a AHA or a BHA based face wash. But if you feel that your skin is just fine and normal, then you use regular face washes containing aloe or maybe lime or, tea tree oil, which just maintains the skin. So you've got to figure out what, but cleansing milk is generally for heavy face products.
Right. We have another interesting question actually. Do we need to change our sunscreen's brand over a period of time?
Wonderful. If you want to, yes, of course. And secondly, if you're required to, I'll tell you the reason why. In summers, I would prefer to use little lighter sunscreen, which is say silicone based, which is a little matte, or something which is water resistant, because you're going to sweat a lot, especially if you're traveling or going out. Whereas, in a winter, you would want to use a little heavier sunscreen, a cream-based sunscreen, so that it also gives you that extra moisturization. So I don't think the brand matters as much, but what matters is the kind of base your sunscreen is having. That is what you need to check.
Yeah, that's actually very interesting. And I also don't ever think about changing my sunscreen with that. I've been using the same sunscreen forever. So I think it's time I rethink that. I think there's someone who's been asking a couple of times now, so I think maybe we should take this up. Do you have any tips for combination skin?
Wonderful. So combination is the most difficult skin to treat or to use a,
Right.
product for, because you're so confused. What should you use, So here the only tip or only advice that I would give is pick up cleansers and moisturizers which are for oily skin, not the ones for dry skin, because when you do that, you are anyways taking care of the T-zone, which is the maximal part. The your cheeks are not as much as you look at the percentage wise. So cleanser and moisturizer as a oily skin, but your sunscreen should be something for dry skin. Now, why do I say so? Because when you use for oily skin, you're actually neutralizing the pH. So you're getting your combination skin to then behave as a normal skin or a dry skin. So then your last step, your sunscreen, should be something for normal to dry skin. So then you maintain the whole thing, right? So you remove the excess oil and then just seal it. So that's the way you pick up your products.
I think it would be nice if we can take maybe just 2 minutes to just tell the audience, because we know that there are 4 skin types. I think there might be people, though there are mostly people here who probably know about skincare. But I think it's also important to share, what are the different skin types that exist, right? And maybe in a nutshell, we can talk about that.
Sure. So, they're not, in fact, 4, there are 6, So let me tell you
Oh,
what.
really? Wow.
So there is
That's news to me.
So there's normal, of course, which, everyone knows. There is oily again, which is, the teenage, lot of oil, lot of, open pores, which are pouring out the sebum. Then you have the combination, which generally comes in, around your 25, 30 age group, and your T-zone is a little oily, but your cheeks tend to become normal to dry, because now your hormones are coming under balance. So, you're getting a mixed kind of skin type. Then the next is, of course, a dry variety, which we generally see post, 50, 55, 60 years of age. Because as we age, the oil glands start shrinking. That's also an aging process. So the oil glands start shrinking and the skin starts becoming dry. So these are the 4 types which we see with age, with change of weather, and with change of place. But you have 2 more types that we keep forgetting, especially when we're looking at products. One is sensitive skin. So, a normal skin is not equal to a sensitive skin, or a oily
Right.
skin is not equal to a sensitive skin. So products for sensitive skin always are different, because here we use absolutely hypoallergenic products which have no fragrance, which have no color, which do not have active ingredients which are extremely strong or exfoliating. So sensitive skin is something very important to know and understand. So that's your 5th. And your 6th is aging skin. Now, aging skin is another completely different kind of skin. It's not just dry skin, but it's aging, because here you
Right.
have to replenish all that is lost. not just the moisture, but even your collagen, your elastin, you know, whatever you want to boost, you want to replenish. So that again is the sixth type. So if we look at it, we have to look at it at a range, you know, the whole spectrum.
Right. Another interesting question, and I think this is something that we talk about pretty much regularly, which is aloe vera gel. So someone has asked, what is the purpose of aloe vera gel in a skincare routine or in taking care of your skin?
Okay, so here I'm apologizing before I begin the answer. I'm going to talk a little technical here, but I think
Sure.
you should, you know, I hope you understand if you don't keep asking me questions. So if you look at your moisturizer, any moisturizer, you know, be it Vaseline or be it the Avene moisturizer, you have three main actives in any moisturizer. One is called a humectant. Now, humectant, you have to remember, is like a sponge. It just absorbs water from the skin as well as from the environment. The second is an emollient. An emollient, if you understand, it's like a cement. So if your skin is like bricks, skin cells are like bricks, the emollient goes in between those dry bricks and joins them together. So you get a soft, supple feel. So that's your emollient. And the third is an occlusive. An occlusive is like, you know, putting a lid on a hot water jar. So no water vapor can actually go out into the environment. It's all in there and then it falls back. It condenses and falls back. So your moisturizer has these three ingredients. Okay, any moisturizer. Now the composition or the percentage of these ingredients tell you what kind of moisturizer it is. Right? So if you have very dry skin, you will put more of the emollient as well as the you know, occlusive, because you don't want any water to go in and you want all the skin cells to be held together. If you have an aging skin, then you want a humectant because you want water to get absorbed from everywhere, so your skin feels a little supple and, you know, a little more softer. So you need more humectant. Now, aloe vera is one of the humectants. So what it does is it, you know, helps, of course, you know, soothe the skin because it has anti-inflammatory properties and everything, but it also tends to absorb water. So when it absorbs water from the environment, it makes your skin nice, hydrated. You feel good. It feels soft. It feels cool. You know, I'm sure most people who use aloe vera gel feel cool. That's because it
Yes.
reduces the inflammation and increases the water content. So aloe vera can be used from head to toe, from your nails to your, you know, heels to your scalp for hydration.
Right. I think that's a very interesting one because generally people say, oh, use aloe vera gel, but I don't think any of us ever realize what it does apart from just soothe and cool the skin.
Yes.
Okay, so I think I assume someone is planning a trip to Goa because they're asking, what is an appropriate SPF for Goa?
You know, you have to just lay yourself in sunscreen if you're in Goa. So anyway, just, you know, make it very simple for you. Yes, you need to use an SPF at least more than 30 plus. Whatever the SPF
Right.
you use, you need to keep applying every 2 hours, and not to forget your arms and legs, which of course will be very exposed in Goa. So don't forget to use, you know, sunscreen all over the body. You can use two different sunscreens. You can use a thicker sunscreen on your face, and you can use a spray or a lotion based sunscreen on your arms and legs because it's easier to apply and you can repeat it every time. One more advice, especially for children, if you're taking them to, you know, a beach and you are using a spray sunscreen, do not spray directly on their face or the body. Use it in your hand and then spray it, because when you spray here, a lot of particles enter the nose and then they cause
Right.
irritation. So always you spray in your hand and then you apply it all over the body. But every 2 to 3 hours, SPF 30 upwards, as much as you can take. 50 to 70 is also fine, but with a PA factor of 3 plus.
Right. Okay, I think we'll just take our last question. And this is again a sort of a general question or something that I think is a general experience that sometimes people go through. It's that when you try a new moisturizer or a new sunscreen or maybe a new skincare product, a lot of times it happens that your skin tends to break out, right? If you change it to something else. Now, I've also heard this, but sometimes they say that, give things time to, perform on your skin. It might break out initially, but it might soothe it later. But how does one tell, and how does one, figure out whether it's good for your skin, whether it's just an immediate reaction and it'll get fine, or whether it's actually a problem and they should stop using that product?
Yeah. So if they are regular products like moisturizer or sunscreen or something like that, immediately when you see redness, you see itching, irritation, you should stop the product. That means your skin
Okay.
is not tolerating it. And mostly the problem is not the active. So suppose, like, for example, I'll tell you, you start using a night serum that has alpha hydroxy acid, and you suddenly see there's a lot of redness and burning and all, and you might think, oh, it's because of the AHA is not suiting me. But that's not what it is. It could be even the base, what it is, what contains. So that also could be a problem. So at times like these, it's better to go to an expert just to figure out why the problem happened. But if you're looking
Yeah.
at a problem solution, like you're using the same AHA for your acne, and suddenly your acne, you get more acne, but still there you need to wait, because many a times what our medications and these actives do is they actually cause all the blocked pores or blackheads to actually form acne and come out, so that you get better treated. So it differs. It differs. If it's more like a treatment plan, then you wait. But if it is a
Right.
feel good product and you start noticing irritation, you should stop it immediately.
Sure. Okay, so I think with that, we've taken a lot of questions. And in case I've missed out any questions, I think you can DM us, or you can even write to Dr. Amee directly, or you can go to her page. It's called Think Skin. Just want to take a quick check. Just if you guys are enjoying this live session, if you're finding it useful, please give us a shout out and give us a quick thumbs up, because we want to bring you more sessions like this. So it really means a lot to have your support here. Okay, so moving on, I think we have a little fun segment. We wanted to bust some myths regarding, skincare. And I've just got 4 with me right now. So I'm quickly going to share that, and we can maybe talk a little bit about what these myths are, why these myths exist, and what's the actual fact behind it.
So,
So the first one is our skin type is the same throughout our life. And I know we spoke about skin type changing with season, but we haven't spoken about skin type being the same or different throughout the life. So what's your take on that?
yeah, so we are not the same at all throughout life, right? Everything changes. We start getting glasses and our teeth fall and there are dental caries and so much more. And in being a live organ, a living organ, it's never going to be the same. You're going to be born with wonderful skin, but it's how you've taken care of it. So
Right.
as you age, of course, hormonal changes, environmental changes, it'll change everything. And also the way you look at yourself, that's extremely important. Skin is like a mirror of your inner self. So if you're peaceful, if you are satisfied, if you're happy, it just shows on your skin. And if you are stressed, like, if you look at these teenagers just before their 10th and 12th board, you look at their acne, they just like, surviving only on acne and anti-acne treatments. It's terrible. So it's how your inner self is. So it's going to keep changing, and we have to deal with it like we deal with other organs.
Right. Okay. The second one is that hot water or warm water is good for your skin.
So yeah, I still remember when my kids were young, we would put oil and then put them in hot water bath, it relaxes their muscles or whatever they would say. But, later I realized that that is not a very good thing, just for 2 reasons. One, we're creating inflammation, so we all want to be anti-inflammatory, and here we're becoming pro-inflammatory. So our
Right.
pigmentation, especially in darker individuals like us, we tend to pigment with any kind of injury. It could be sunlight, it could be hot water, it could be, just picking on your pimples, it could be sitting with your elbow on your, on your desk. That's all going to lead to pigmentation because it's a kind of injury. So hot water is. So use lukewarm water as much as you can. The other thing hot water does is, because it increases the temperature of the skin, there is a lot of evaporation of water that happens. So your skin tends to dry. So that is another
Right.
issue with hot water. So these two things you need to remember. Steam is good because if you sit in a steam chamber, there's a lot of moisture. So that moisture will
Right.
then penetrate into your skin, but not hot water and then immediately getting out.
Right. Okay. The third one, which is also interesting and something I've never thought about, is lips do not sunburn.
What do you think?
Well, I think being as it is part of our skin, I think it should also experience sunburn the same way the rest of our body does.
Yeah, so it does. You're right. Like garam chai pili, or you have had something very hot, a hot liquid, you can actually see your lips burn, right? So it's like just like that. Although, of course, sun is not so close to our lips, so you see it very slowly.
Right.
And, you realize that only when you start licking too much and your lips become completely
Hmm.
dry and the dryness extends around your lips. So this part also starts
Right.
dry. We call it lip dermatitis. And that's when you go visit a doctor,
Ah.
go and check what to do. But the culprit is the sun, is the exposure,
Oh.
which dries out your skin. Then you start licking. And most people forget that saliva is a digestive enzyme. It's not water or moisturizer. So we keep licking thinking sinus chali jayegi, but actually we are digesting our lips. So it's as simple as that,
Wow.
because saliva contains an enzyme called amylase, which tends to digest the skin. So so
That is scary, kind
which
of.
is why most
So,
moisturizers should be applied on your lips too,
on
lip
the
and
lips, I was actually going to ask you that should we be making sure that we're putting sunscreen on our lips as well? Because
absolutely.
I don't think I pay attention to that very much.
No, absolutely. And you can pick up, you get such lovely lip glosses and lip balms which have SPF in them. So if you're
Right.
not putting, see, people wearing lipstick, one advantage is this, that they get protected naturally because,
Mhm.
it's a physical fluid. But if you are not, pick up lip balms that contain an SPF. That's really going to help.
Right.
And when your skin dries, you need to use excessive lip balm and not lick.
Right. Right. Okay. The last question, and I think we somewhat answered this, but I'm going to ask it anyway. Waterproof sunscreen lasts all day long.
Yeah. So here we don't realize that, the whole day we are not only exposed to water, but we're also exposed to our hands, to masks now, and so many things. And
Right.
more or less, if you look at all these things, right, they tend to wear off. A chemical, even if you're using a chemical or a physical sunscreen, the effect wears off after a particular time. So our chemical sunscreens wear off, say, within 2 to 3 hours, the effect of it. And our physical sunscreens, the minute you touch your skin like that, you've taken out part of your sunscreen. So repeat sunscreens, whether they're water resistant, waterproof, you have to keep repeating every 2 to 3 hours till, of course, the sun is around.
Right. Right. Okay, that brings us to the end of our myth busting section. There's one more question actually that I've received, which I think is interesting, and I think a lot of people may want to know about. So I'm just going to take that one as well. It says, how much does yoga and breathing help to keep skin wrinkle free?
Okay. So that's like, taking a long route. Uh, as I said earlier, skin, mirrors what is there inside your mind, inside your body. So just to add here, again, I'm going technical, I'm sorry, but skin is directly related to two organs. One is your gut and second is your mind. So whatever,
Yeah.
if you have high acidity, you tend to get acne. If you have digestive issues, you tend to get dry skin or even very funny skin. Few days it'll be oily, few days it'll be dry. Few days you'll get rosacea. So gut is directly related and is your mind too. So when you're stressed, when you are unhappy, when there is an issue, your skin is going to show changes. It could be pigmentation, it could be dryness, it could be acne. So if you find with yoga and meditation, if you can cool yourself down, if you can reduce that stress, it's going to show on your skin. So it's very simple. It's extremely simple. You cool
Right.
yourself, you are happy and satisfied, your skin just shows it.
Right. I thought that was a very interesting question, and I
Yeah.
think a lot of people also talk about, doing things like face yoga and
Yeah.
all of those things.
So see, face yoga is more related to how the muscles get toned so that you don't
Okay.
get, so that's more
Right.
going to the gym and working out. This is like gym for the face. You do those facial yoga and all that, and you keep your muscles toned up so that they don't show the sag. So that's another way to do. I don't know how much it helps, and I don't know how permanent it is. It could be the
Yeah.
time to do that you will notice a little change, but that'll be more internal, muscular than the skin outside.
Right. Right. Okay, someone has also asked if we basically apply the sunscreen. I think people also tend to wear makeup on
Hmm.
top of that, right?
Yeah.
So, if you are to reapply in those cases, what do you do? Can you
No, no.
reapply it somehow on it, or do you need to?
No, then you don't need to reapply because your
Right.
foundations, your BB creams are anyways physical sunscreens, you know.
Okay.
So you don't need to reapply unless, of course, the makeup wears off. Like suppose you're a dancer or, you're a theater artist and you've sweat so much and the makeup has worn off is when you need to reapply either your makeup or the sunscreen. But in a regular routine, like when you go to office and you've applied a good a foundation, then you don't need to reapply it.
Right. Okay, I think Dr. Ami, thank you so much. I think just taking a quick time check, and we have about 10 minutes to go, so we'll start wrapping up now. But I think for me, this interaction was extremely interesting. I think I have personally learned a lot more about skincare thanks to you, and thank you so much for taking the time out and doing this with us. It was really, really great.
Thank you. Thank you. I'm glad. And I hope everyone else also, has learned a little more about skin.
Absolutely, absolutely. For everyone out here, again, Dr. Ami runs Think Skin Clinic. I think you should be able to see their page linked right up here. In case you do have any doubts or which are more specific to any kind of skin concerns, I think you can also reach out to Dr. Ami. Apart from this, I just want to say again that we have Skin Expert, which is a tool that essentially enables you, empowers you to personalize your skincare regime. It allows you to understand your skin and be able to pick products that really suit your skin. And you can, pick it up right from Health and Glow, whether it's online or on the app. So I really, really encourage all of you to go and check it out. It's a free analysis, so essentially you don't really have to pay anything. It's quick, and I'm sure that you guys would love it. Please do also share your feedback on this session. I hope you all enjoyed it, and happy to hear or take any inputs on future topics. If there's something else that you would like us to cover. Our next session that Dr. Ami and Health and Glow we have planned is going to be on summer skincare and travel skincare. We know that a lot of people are traveling right now. So, it's something that I think will be very helpful. And given how hot it has really become, I think never experienced heat like this so early in the year. I hope that that's going to be useful for everyone. I think, Dr. Ami, maybe you would like to quickly summarize what we've learned in today's session.
Absolutely. So just want you to remember that skin also is a living organ. Please treat it right. It's not a beauty apparel that you can keep, experimenting with. Be very gentle with your skin. And remember, nothing is permanent. So do not, do not try and be what you were when you were in your teens or your 20. I think it's very important to accept aging. Of course, try and keep your skin healthy, but do not worry or fret over very small things because they will lead to larger problems than actually treat that. So a couple of acne or a few lines and wrinkles should not bother you. Maintaining your skin, keeping it healthy is all about beautiful skin.
Absolutely. And I think something so important also is that skin is so related to your confidence. I think everyone should be able to feel comfortable in their skin, and like you said, I think don't stress about it. I think everyone in their own skin is beautiful, and everyone should be able to feel that. And for anything else, of course, we're here for the right advice. Um, Great. So, guys, stay tuned for the announcement of our next session. We haven't decided the date yet, so we should be able to share that sometime soon. Please do share your feedback, and any kind of inputs would be helpful to make this even better for you next time. Thank you all for joining in. Thank you so much, Dr. Amee. It was a pleasure.
Always there for you all. Bye-bye.
Take care, everyone. Bye-bye.